everyone, Dr. Amanda Zariello from Restore Physical Therapy in Cranston, and today I'm going to talk to you about trigger point dry needling. Trigger point dry needling is a technique that we use to help decrease trigger point related muscular pain. And we can get trigger points all over our body, upper trap, quad, calf, anywhere that we have muscle essentially. And that trigger point can be a source of pain for people. So I'm going to talk about specifically the upper trap muscle. A lot of times people who have pain in their neck or even referred into their shoulder have trigger points that are contributing to this pain, and dry needling can really help release that pain. So what is a trigger point and why do we get them? A trigger point is basically a taut band of tissue, and muscle fibers are actually in a contracted state when they should be more in a relaxed state. And when the muscles are stuck in that contracted state, there's a buildup of chemicals, one of which is acetylcholine, which is a neurotransmitter that helps our muscles contract. And there's a buildup of that in this area. There's also a lack of blood flow, and a lack of blood flow into this area can cause lower oxygen and essentially pain. So the dry needle is a thin filament needle. It's like an acupuncture needle, but it's not acupuncture. And we put this needle in that trigger point, and when the trigger point hits when the dry needle hits the trigger point, it causes a local twitch response, which is actually an involuntary contraction that is initiated by our spinal cord. And when that happens, we know that the treatment worked because it helps to take that contracted muscle into a more relaxed state. It helps to balance out the chemicals in that area that were contributing to the pain. It increases blood flow, which brings oxygen and nutrients to that area, and it helps with pain modulation. So dry needling is a great way to find immediate effects in decreasing pain. However, you never want to do dry needling alone, because again, the reason why that trigger point might be there is not the only reason why you're having pain. So why does the trigger point even occur in the first place? It's usually in an overworked muscle. So say you go to the gym and you did a lot of overhead pressing that day, more than usual. Your muscle wasn't necessarily ready for that load, and that can cause pain and trigger points in that muscle. Another reason why we can develop trigger points is sustained posture. So say we're sitting at a desk 8 hours a day and our head is forward. Those muscles have to work a lot harder to hold our head up because it's further away from our body. They don't have to work as hard when the head is settled over the shoulders. So that's another reason why trigger points can develop in a muscle. Breathing pattern is another. We talked about this in another video, how a short, shallow breath puts a lot more work on these neck muscles, the upper trap specifically. So your breathing pattern can contribute to this, and compensations for your shoulder. So if you are weak in your shoulder, if you have tightness in your shoulder and it's not functioning properly, the upper trap is compensating for those impairments, those weaknesses, those stiff areas in the shoulder. So those are 4 things that we want to look at to correct, not just dry needle. So the dry needling is a great technique to help relieve the pain and basically give that muscle a reboot, and the exercise prescription should fix the patterns, the movement patterns, the reason why those trigger points developed in the first place. So check out this video on what dry needling actually looks like in an upper trap muscle. So we're going to dry needle the left upper trap. Okay, this is a thin filament needle, just like an acupuncture needle. And the first thing I'm going to do is just palpate to find that trigger point, which right about there. It's that top band of tissue that I was talking about. I'm going to hold it, and we should see a twitch response. So I'm going to put the needle right here. There we go. Doing okay? Oh, there's a twitch right there. And that's what we're looking for, and then we can take that needle out and just massage it, and you can already feel a little bit less tension in that muscle.